I would like to introduce for our first speaker this morning the program director here at Valley Vista and thank her for her hospitality in hosting us this morning. Please welcome Kristin Williams.
Good morning. Valley Vista would like to warmly welcome Governor Holcomb, Executive Director for Drug Prevention, Treatment, and Enforcement, Jim McClellan, Indiana Family and Social Services Administration Secretary, Dr. Jennifer Walthall, council members, members of the Greenwood and extended community, and other distinguished guests. We are honored that you are here with us today. As you are aware, our country is facing a brutal epidemic, one that continues to affect the lives of us all. We are reminded of the devastating effects of drug addiction on a daily basis. Staggering statistics are presented to us in the news, on the internet, and in our social media feeds routinely. Our local community has been significantly impacted by the disease of addiction, and today we stand here presenting a united front, ready and willing to expand efforts to address this epidemic. Governor Holcomb has taken a firm stance on the issue of drug addiction in our state, and he has appointed and rallied trusted officials to further his mission. Valley Vista is entirely committed to providing evidence-based services to individuals in the community to support their recovery from drug addiction. As a service provider, it's an honor and a privilege to serve the community in this capacity and to be a beacon of hope for those seeking recovery. We have an obligation to partner with local officials and other service providers in an effort to enhance the prevention and treatment of drug addiction. Today marks a pivotal moment for us in the treatment of opioid addiction, a widespread and powerful force that really does require the efforts of us all. Governor Holcomb and his appointed officials have intentionally targeted opioid addiction, and today's announcement reveals the state's effort to expand treatment options for this population. So again, we would like to thank you all for being here today and for the continued opportunity to serve our community. Thank you.
Good morning. I'm Jennifer Walthall, the Secretary of Indiana's Family and Social Services Administration, part of the Holcomb administration. We recognize that substance use disorders are chronic disorders of the brain. We believe that it's essential to work to reduce the shame and stigma associated with substance use disorders. We strive to ensure that substance use disorders and other mental illnesses are covered and reimbursed appropriately. We acknowledge that most people with substance use disorders also experience co-occurring mental health problems. Thus, we see a need to promote treatment that takes into account both kinds of disorders. It is our belief that treatment for substance use disorders should utilize evidence-based methodologies, including both medication and psychosocial interventions. Indiana's Family and Social Services Administration works to promote increased access to and education about overdose reversal medications like naloxone for first responders, families, and persons with substance use disorder. Finally, we realize the need to grow Indiana's treatment and recovery workforce through education and training. Therefore, we are excited to announce the addition of 5 opioid treatment programs in Indiana's authorized under Indiana Code 1223-18-5.5. The 5 new OTPs have been strategically placed in locations around our state to assist with reducing driving time for individuals in need of addiction treatment for opiate use disorder and sited in or near counties with high numbers of naloxone use, the overdose reversal drug used by emergency responders. The counties include Allen, Johnson, Monroe, Vigo, and Tippecanoe. We believe that the new OTPs will allow increased access to multiple medications as part of medication-assisted treatment, or MAT, programming, and reduce illicit substances, moving individuals toward long-term recovery. The 5 new treatment programs are Allen County at the Bowen Center, Vigo County at the Hamilton Center, Monroe and Tippecanoe counties, Sycamore Springs, and Johnson County, Valley Vista. We're really proud to have these new partners as part of our team. We also are excited to announce an important policy change in medication-assisted treatment through Indiana Medicaid. Effective August 1st, 2017, Indiana Medicaid members, including all Healthy Indiana Plan members, will have coverage for all services provided in an opioid treatment program, including coverage of methadone for opioid use disorder. Methadone is one of 3 FDA-approved medications for treating opioid use disorder, and Indiana Medicaid already has coverage for buprenorphine, known as Suboxone, and injectable naltrexone, also known as Vivitrol. To date, Indiana Medicaid has not reimbursed for medication-assisted treatment using the agent methadone. We feel that access to care has been a significant barrier, as this medication can only be dispensed at a certified opiate treatment center, and the vast majority of whom have not participated in the Medicaid program. Studies have shown that patients receiving methadone are more likely to remain in treatment and to reduce opioid use compared with placebo or non-medication treatment. Methadone treatment has been associated with reductions in the spread of HIV and with reduced criminal behavior. Thanks to the work of the Indiana General Assembly, FSSA is confident that we can increase access to this service for Hoosiers across the state of Indiana. Senate Enrolled Act 464, passed during the 2015 session of the Indiana General Assembly, authorized our Division of Mental Health and Addiction to promulgate rules and add 5 new OTPs to combat the opioid epidemic. Senate Enrolled Act 297, passed during the 2016 session of the Indiana General Assembly, requires all OTPs to participate in the Medicaid program by July 1st. This was on Saturday, as a condition of operating in the state of Indiana. FSSA does not prefer one medication over another, thus adding methadone maintenance treatment as a covered service gives physicians another treatment option for patients struggling with addiction. We firmly believe that any treatment plan, including medication-assisted treatment, should be accompanied by counseling and support services. And this is why we're confident in our decision to cover methadone maintenance treatment. OTPs do not simply dispense medication. They provide patient education, counseling, and support programs as part of their treatment model. We are encouraged that expanding substance use services to include services provided by OTPs will help connect countless Hoosiers with treatment and become healthy and productive members of their community. This is how we combat an opiate epidemic, by putting people first and embracing the integration of science, data, and compassion as we make policy decisions that benefit Indiana. Thank you for being part of the solution with us to assist our fellow Hoosiers in the path to recovery. At this point, I'd like to welcome the speaker of the hour. I am so excited to introduce to you our speaker for the morning, Amy Arden. I met Amy on Monday, and I'm just incredibly compelled by her story, and not just her story, but the millions of stories that she represents, that I think you'll see these, what seem like small changes, are not. You add them up one at a time, and they become a groundswell of change. And so, welcome to the podium, Amy.
Good morning. As she said, my name is Amy. I am a patient at a methadone-assisted treatment center, well, actually a medicated-assisted treatment. I personally take methadone. A little bit of my story, I was an addict for 10 years. I had never taken any kind of medicine other than ibuprofen or Advil or Tylenol until I was in my 30s. I suffered a back injury, don't know exactly what caused it, tried many different things, nothing worked. So to keep me able to continue to work and function normally, I was prescribed pain meds, and it quickly became a very huge problem very fast. Part of the problem is you know, the first time you take it for a reason other than for pain, it's already too late. You already have a problem. And it spirals out of control very quickly. I used for 10 years, the last 5 years was me on and off trying to do this by myself, and I could not do it. I would go 3 days and I would be so incredibly sick that I could not function. I couldn't go anywhere, I couldn't do anything, I was miserable, so I would go back to using just so I could function. And that's no way to live. A friend of mine had been trying to get me into treatment for a very long time, and because he was in treatment and it was working for him. So then I finally took him up on his offer, and I realized that I was getting ready to walk down a road with heroin that I may not ever come back from. So I called the 2 treatment centers in Indianapolis, and one could get me in the very next day, and I went in there, and it was a life-saving decision that I made. Because I realized what was missing. What was missing is you can't do this by yourself. You have to do this with other people. It's not a solitary endeavor. So I got there, and yeah, you know, the first 90 days are incredibly difficult because you're trying to figure out where you're at and what you do and how you do it. But they have such wonderful people there to help guide you through this and to realize that it's not just about taking the medication. The medication is what makes you able to do the other things, to go to groups, to meet with your counselor, to read books about your addiction, to educate yourself, to figure out how this looks for you, because it looks a little bit different for every single person. So I was afforded that opportunity, and I think that this is a wonderful thing that is happening because there are so many people at the facility that I go to that drive for hours and hours and hours just to get there, and they drive for hours and hours to get home. And then, you know, how do you work a job and do that? And any little fly in the ointment becomes this huge, huge debacle. So it's just such a wonderful thing to know that this has been such a long time coming and that people are finally seeing that this is something that needs to happen. We're normal people just like everybody else. We just want to work, and we want to be part of the population, and we just want to go and get our treatment and live our lives. That's all we want to do. And this is a very proven method of doing it. It has made me able to work and to meet obligations and to do things that I had not been doing for a very, very long time. And I finally feel like a normal person again. So I'm very incredibly grateful for this opportunity to help put a face to all of us who are part of this, program, and that we just want to be heard, and we just want to be able to live our lives and get treatment. That's all we want, and this is a wonderful way to do that. Thank you.
Eric Holcomb is the 51st governor of the state of Indiana. Prior to his election, he served as Indiana's lieutenant governor and was a trusted advisor to former Governor Mitch Daniels, Vice President Mike Pence, and Director of National Intelligence Dan Coates. Governor Holcomb is a veteran of the United States Navy and a graduate of Pike High School in Indianapolis and Hanover College in Jefferson County. He is the author of Leading the Revolution, a book detailing his experiences with leadership and executive management. A lifelong Hoosier, Eric has shot and made a jump shot in each of Indiana's 92 counties. A student of history, he is also a collector of presidential signatures and has documents signed by 42 of our nation's 45 presidents. He and his wife Janet live in Indianapolis with their dog Henry, and we are so excited to be part of his team. Welcome.
Thank you, Dr. Walthall. I may never look at the state seal the same. Amy, seeing the sunrise and people going to work in the morning, getting their life back, having light shining down in what may be an individual's darkest hour, this is a day of encouragement for us all. And I just thank you for your courage and your strength and your desire, not just to be here, but to be on this journey and to know that others are walking with you. Also want to thank Kristin and your whole team here. This is an incredibly impactful place in such a positive way. And I thank you for your service and your focus and your perseverance day in and day out. I know how challenging this work can be. Doc, so proud to be standing with you as we not just confront this, but overcome all the hurdles that are currently standing in our way. But again, this this day is symbolic in ways far beyond we'll realize by sunset today. This is going to lead to lives being brought back. So, incredibly proud to be here and to understand why we're here, the expansion of our opioid treatment programs with the 5 new facilities that will be simultaneously brought online in these underserved areas are truly going to save lives and allow those battling substance abuse and substance use disorders getting back to leading productive lives, as Amy just articulated better than I could ever. As governor, many of you know I've made this a key focus of my entire administration. You see me flanked by Superintendent Doug Carter and Jim McClellan. On the very first day, I signed an executive order. We hit the ground running from that very first minute, and we stood up a new department that answers directly to me, oversees multiple agencies, because we all share in some of the responsibility of, as I've said before, if I could only have one wish, if I could only accomplish but one thing in my time, it would be to bend that trajectory, bend that arc down on the course that we're currently on. This is not an Indiana-centric issue. Representative Burton and Senator Sandlin have cohorts all over the country that I know you hear from. I hear from my fellow cohorts who I think feel the same, that if they too could only have one wish, it would be to reverse course for so many people that feel anchored by this very difficult issue. You think about, and you can almost drown in a sea of statistics when you think about where we find ourselves today. Since the year 2000, deaths from drug overdoses has increased by 500%. Deaths from drug overdoses have increased 500% since the year 2000. And sadly, we here in Indiana, we rank 15th in the nation in overdose fatalities. And probably most of the folks in this room and many in this community and certainly in our state have seen up close and personally just how this impacts everyone, that ripple effect from the family to the community to businesses. It's become a crisis on multiple fronts. I've also shared this example. At one point, there was a business in the state of Indiana that had a sign up that said, "Now hiring, we do not drug test." That's where we find ourselves. 60% of the Department of Corrections inmates test positive upon arrest. 80% of heroin users started with painkillers. 80%. One story that I heard while I was on the road that I can't shake is about a young lady who shot up in a hospital parking lot, went inside, delivered her baby, and then was found later that day shooting up again in the hospital bathroom. And just last month here in Greenwood was the first Indiana community to report an overdose from Gray Death, this new drug cocktail with such a deadly and potent mix. And this is why we are here today. It's why we're launching this critically important next step. These 5 new OTPs will reduce that driving time for individuals that are seeking treatment for their specific addiction. And they're, as Jennifer said, they're where they need to be. We are meeting the need where it is most urgent. We're tracking, we're using the data that we've accumulated through various sources and we're using it. Expanding these services is going to help, I think, connect so many folks who are struggling right now with the services that they need to, again, as Amy said, become healthy and productive members. And I just want to underscore the word again, because we know they will. We're not going to be able to just arrest our way out of this problem, and that's why these new centers are just so important. We'll come alongside those who are struggling and with the addiction, and we'll make sure that they don't, again, fall through the cracks, that they get on and that they stay on their road to recovery. And that's how we're going to attack this problem. It was said earlier, we're going to put people first. And even when those are surrounded by that darkness and can't seem to find a way, that we will become that light. And it's just so energizing and encouraging to be surrounded with so many who share the same goal. This is what has made our state special from the very outset, that we subscribe to this teamwork, getting on the same page and addressing problems no matter how difficult they may be. So thank you all for being part of the solution as we assist Hoosiers on getting back on their road to recovery. Thank you.
Thank you, everyone, for joining us this morning. It's really compelling for our agencies, our communities, our families, our patients, our loved ones to come together around a difficult issue that has not yet crested. We haven't seen the worst of it yet, but we certainly can put a comprehensive plan in place so that we're ready to meet people at their point of need, not what we perceive their point of need to be. With the full spectrum of education and prevention, treatment and enforcement, and the strategic plan that Jim's team has put together, I feel confident that we're going to be able to make both short-term interventions like you're seeing today, and then long-term plans so that a generation from now, we have a state full of people who are safe and fulfilled and happy and healthy. Thank you so much again for being with us this morning.